Hi guys, welcome to our YouTube channel Nursing Update. Today we'll see the third set of questions in Oncology Nursing. We have already uploaded part 1 and part 2 of this video. So today we'll see the third part. Okay, so I have already discussed also. These are the MCQs which are came in 2019 exams. Okay, whatever exam happened in 2019, those MCQs only I am covering. Okay, so I didn't take from any books or anything else. Okay, let's move on to today's video. So if you are new to our channel, please subscribe our channel. Okay, and press the bell icon also. Okay, let's move on to our today's video. Okay, first MCQ. A patient is caring for, a nurse is caring for a patient in oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? Okay, so on oncology ward, okay, patient is neutropenic. What is the most important nursing intervention you will do? Option A, change the disposable mask immediately after use. Change gloves immediately after use. Option C, minimize patient contact. Option D, minimize conversation with the patient. Okay, so the answer is minimize patient contact. Why it is important? Actually, there are two types of isolation precaution is there. Okay, one is isolation, another is reverse isolation. What is isolation? Isolation means suppose a patient is there infected with TB or COVID-19. Okay, let's take as COVID-19 as example. He is infected with COVID-19. We isolate him. Why? To prevent the infection to spread to other. Okay, from that person. Okay, from a patient to another patient or to healthcare worker, we isolate. That is known as isolation. What is reverse isolation? Reverse isolation means from healthcare workers, the patient should not get the disease. For example, if suppose an immunodeficiency patient is there, okay, and the nurse who is taking care of that particular patient is suffering from common cold or something else, then the patient may develop that cold because they are already immunocompromised. Okay, so same thing in neutropenic patient or the patient who is on chemotherapy, you have to minimize the patient contact. Okay, so next MCQ, priority nursing intervention for terminally ill patient with metastatic bowel cancer is option A, maintain optimal bowel function. Option B, chemotherapy. Option C, pain management. And option D, normal respiration. Okay, so maintain normal respiration. So they have asked a patient is there with metastatic. What is metastatic? We have already discussed. It has been spread to other organs. Okay, bowel cancer. So what is the priority nursing intervention? Okay, as a nurse, what is you do? Okay, you do palliative care. What is palliative care? That also we have discussed. Okay, what is the specific palliative care for metastatic bowel cancer is maintain optimal bowel function. Okay, so already bowel cancer is there, so do colostomy or something else. Okay, so that they can live a normal life. Okay, so that is more important. Okay, so another one option is there, pain management. This is also somewhat near to that disease condition, but maintaining optimal bowel function is more important than anything else. Okay, then radiation therapy for cancer prostate causes bladder irritability, can be manifested by option A, dysuria, option B, hematuria, option C, pain, and option B, dribbling. Okay, so the patient is on cancer prostate and getting radiation therapy for that disease. Okay, how will you diagnose the patient is having bladder irritability? The answer is dysuria. Okay, so another option is there, hematuria. Why I didn't choose hematuria? Because in cancer prostate, painless hematuria is the clinical symptom. Okay, the patient will be having the clinical symptom, but after radiation therapy, the patient is developing bladder irritability, means the patient will manifest dysuria. Okay, so as I have already told you, these all MCQs have asked in 2019 examinations. I didn't take from any of the books. Okay, I didn't make any of the MCQs. These all came in some exams in 2019 alone. Okay, Then, next question, predisposing factor for cervical cancer is option A 45 years nullipara, option B 45 years multipara, option C 50 years multipara with first child at 22 years, and option D 40 years nullipara who is on OCP. In this question, they have asked the risk factor. Okay, the woman who is on more prone to get cervical cancer. Okay, so they have given 4 options. I hope you know what is nullipara, what is multipara. Okay, so nullipara means the woman who never given birth, and multipara woman who have given more than 2 births. Okay, so the answer is 40 years nullipara who is on OCP. Okay, so the thing is, the woman who is taking the more amount of OCP, what is OCP? Oral contraceptive pills, are more prone to get cervical cancer. Okay, that is the key point in this. Okay, woman who is more prone to get cervical cancer are the woman who is taking more number of OCPs. Okay, oral contraceptive pills. Okay, clear with this? Then move on to the final MCQ of today's video. Preferred site for bone marrow aspiration is option A femur, option B iliac crest, option C sternum, and option D tibia. Okay, so they have given which is the most preferred site for bone marrow aspiration. They didn't mention child or adult or anything. So the answer is iliac crest. Okay, so most preferred site for bone marrow aspiration is iliac crest. Okay, so in iliac crest, in children they will take from anterior superior iliac crest. This is also MCQ case. Okay, in children, which is the most preferred site for bone marrow aspiration? It is anterior superior iliac crest. Why iliac crest is preferred? Because there is no much vital organs. If you take other bone sites like femur or sternum or tibia, vital organs are there. Okay, if you take sternum, lungs is there, heart is there, there are chances for puncturing the vital organs. But if you take iliac crest, the chances for puncturing the vital organs are very less. Okay, so that's all about today's video. So if you like our videos, please subscribe our channel, press the bell icon, and share our videos among your friends. Thank you so much, guys.